Dr. Ashok, please.
Okay.
Yeah, it's coming. Hello. Yeah, I've joined, but I can't see. Only AP is seen there. Yeah. Okay, but what is to be done next? I can't see anybody. I can't see only it's a blank screen with AP written on it. And I can see people joining 112. Yeah.
हाँ मैं मोबाइल से कर रही हूँ कितना किया
Okay, okay. Yes, yes. Now, it's you are visible to us.
You can see me?
Yes, very much, very much.
But I can see only a blank screen. No, I can see blank screen with AP written on it. Your spotlighted, your video is highlighted for everyone in the meeting. That is what is coming up. Yeah. That option only is not there.
Now we have bar with video, icon, mic icon, and other things.
See this now? Yeah, they have put up the slide. Camera is on.
Good afternoon. Good afternoon, one and all. This is Alvin Pais, your moderator for this session on management of pathologically advanced cases. Welcome everybody, and thank you very much for showing such a great response. Good afternoon, Dr. Ashok Borkar. Good afternoon, respected Dean, our faculties at Yanapoya, and all the faculties of esteemed colleges all over India. I would first and foremost apologize for being slight. There was a technical hitch from our side. I would like to request Dr. Apeksha, Assistant Professor, Department of Materia Medica, to speak a few short details about the achievements of Dr. Ashok Borkar. Welcome, Dr. Apeksha.
Good afternoon, everyone. It's indeed a pleasure introducing the speaker for today's national webinar, Dr. Ashok Borkar. Sir attained his BHMS degree from C.M. Patel Homeopathic Medical College, Mumbai University in the year 1990. He got his master's degree in repertory from Rajiv Gandhi University of Health Science, Bangalore. He started his practice as a homeopathic physician in the village of Paroda, Goa in the year 1991, now practicing in Margoa. Sir is a visiting lecturer of organon and philosophy at Sri Kamakshi Devi Homeopathic Medical College, Goa. He is a teacher and consultant physician at the Adasong International Academy of Advanced Homeopathy, Mumbai. He is also a faculty for the British Institute of Homeopathy, New Jersey, USA. Sir has authored internationally acclaimed books like Pathology Factor in Remedy Selection, Blockbuster in Homeopathy 2015, Lesser Known Rheumatic Remedies, and Diabetes Repertory. Sir has delivered a 4-day seminar on latest advances in homeopathy in Budapest, Hungary, and Europe. He has also conducted various seminars at Mumbai, Hyderabad, Sangli, Cochin, Chennai, Ludhiana, and Kolhapur on the topic management of pathologically advanced cases. He has conducted blockbuster workshops at Mexico, Israel, Goa, and Pune. He was speaker at various national and international conferences held at Goa, Mangalore, Bangalore, and Sydney. Sir is currently involved in the management of renal failure cases in the Concona district of Goa, where renal failure is rampant. With this brief introduction, I extend a warm welcome to you, sir. Thank you.
Thank you so much, dear Dr. Apeksha, for a very suitable and much appreciated biography and details of Dr. Ashok Borkar. Hope is a good breakfast, but sometimes a bad dinner or a bad supper. But with Dr. Ashok on our side today, we assure you that the breakfast and dinner is fantastic. The hope we assure you that you will be enriched by the presentation of Dr. Ashok and his rich expertise in treating hopeless, so to say, pathologically bad cases. So welcome, Dr. Ashok Borkar. The screen and the stadium is yours.
Can you see the screen, doctor? Hello? Hello,
Yes,
everybody.
yes, very much.
You can see this, right?
Yes, Dr. Sir. Yes. Please carry on. Yeah.
Yes. Hello, everybody. I am Dr. Ashok Borkar, and I have been practicing homeopathy in Goa since 1991. Before I begin, let me ask you a few bothersome questions, questions which really troubled me for many years. And these questions are especially for those who have been practicing for a few years now, those who have seen cases in their OPD, interns, fresh doctors, PGs. So tell me, do you face failures in your practice, especially in pathologically advanced cases? In spite of being good in case taking and analysis? Have you faced failure in spite of prescribing a totality based remedy which covers all the characteristic mental and physical symptoms? Do you know how the masters practiced? Have you read the cases of Hahnemann, Burnett, Kent, Boger, Clark, and other masters? Do you know how to adapt homeopathy to the adverse circumstances faced by patients in this internet age? Some teachers teach us that we have to use only single doses of constitutional remedies. And others use multiple remedies. What should we do? And why? How do we get good results? I struggled with these problems for many years until I found some effective solutions to them. I'm here to share my experience with you and I assure you that by the end of this session, you will get simple solutions to many of your complex problems. Our books mention many cures of pathologically advanced conditions, and every homeopath has a few such cures to their cure. So it is obvious that it is the homeopath who fails and not homeopathy. In order to get solutions to my difficulties, I started studying my successful cases and the cases which I saw in seminars of other teachers. And then I saw a pattern emerging. I saw that in every cured case, the pathology was covered by the remedy. For 20 years, I was following the dictum, treat the person in disease and not the disease in the person. I realized that we have to give importance to the person in disease as well as the disease in the person. I started reading the works of masters and I found that this idea was well supported by their writings. The master who has had maximum success in such cases is James Compton Burnett. He writes it is not enough to cover the totality of the symptoms. For when this has been done, we are only halfway. We have to ask these questions. What is the real nature, the natural history, the pathology of the malady under consideration? Is the drug chosen capable of producing a real disease like the one before us? In fact, is it morbid? Is it really homeopathic to the morbid process? I put this newfound old knowledge in my practice. I applied it in practice and I started getting better results. That's when I wrote my first book, Pathology Factor in Remedy Selection. Pathology means what? Pathology means pathological process. Like inflammation, allergic manifestations, hypersensitivity, tumors, dropsy, cramps, suppuration, hemorrhage, ulceration, these are all pathological processes. So this has to be covered by the remedy. So when I use this in my practice, I got good results, and this is the book I wrote, Pathology Factor in Remedy Selection, in which I have explained how to use the pathology to cure such difficult cases. One of the cases in the book, which was a turning point in my career, is the case of a 52-year-old man suffering from stage 3 multiple myeloma, which is the last stage of this cancer. So let me tell you about this case. Life expectancy for the last stage of multiple myeloma is just 1.5 years. This patient was told that they cannot give him chemotherapy because he was too weak and not fit for it. He was so weak that he did not have the strength to talk or walk. He was carried by 4 people and brought to my clinic. He had fractures in his ribs and he was getting severe cramps in the muscles. He was 52 years old, but actually it looked something like 92 years old. He had sneezed and he had got fractures in the ribs because there is osteoporosis in multiple myeloma. He had great difficulty in rising from a seat, and initial movement was very painful. But he was able to walk slowly after taking a few steps. The pains were worse at rest. And he had pulling type of pains. And he would get stuck in one position whenever he would get a cramp. So I considered the following symptoms. Initial motion aggravates, better by continued motions, aggravated rest, cramps, and unable to move. The pain was as if pulled. What came up was Rustox. So I gave him Rustox 30. After 4 days, his son reported that he has been screaming with the pains. He was worse, and he was better only when he was fanned. He would get sudden sharp poking pains on least moment, which would make him shriek. And he had not passed stool for 8 days. So I considered the symptoms which were present now. I took shrieking with the pain, draft of air ameliorates, little motion aggravates, sharp poking pains, constipation, and this led to Bryonia 30. These symptoms were covered with Bryonia 30. So I started giving him Bryonia 30. He would feel a little better whenever I had given a dose of Bryonia 30. But then I had to repeat it again and again and again. I had to give it every day. But after a few days, the pains went on increasing and he was completely bedridden. They said that he was like a statue in bed. because he just couldn't move. He developed a great fear of pain and would get scared when anybody would enter the room because they may move him and he will get pain. This was 1 month after I saw him first, and the situation was really bad. At this point, I decided to look at the case from a different angle. I decided to give importance to the pathology. What was the pathology here? So what is this multiple myeloma? It is a malignant proliferation of plasma cells. And these malignant cells produce cytokines which stimulate osteoclasts and results in net bone absorption. So the resultant lytic lesions cause bone pains, fractures and hypercalcemia. Lytic lesions means holes in the bones, destruction of bone. So there is bone pain, fractures and hypercalcemia. So what is the pathology here? What happens in this disease? Osteoporosis. And there are osteolytic lesions. The sphere of action is bones. And what is the type of action? Means what is happening to the bones? It is a loss of calcium from the bones. And there are holes in the bones. In simple words, you have to know the sphere of action and the kind of action. So which other part of the body is involved? The muscles, where he is getting cramps. Sphere of action muscles, and what is the type of action, kind of action? What is happening to the muscles is cramps. And what was the disease process going on in the body? Cancer of the blood cells. So now I repertorized in a different way. I took pathological rubrics from the repertory and I saw in general it is softening of the bones, necrosis of bones, cramps in the muscles, cancerous affections, and the two mental symptoms of shrieking with the pain and fear of pain, which were present at that moment. And a completely different remedy came up. What came up was aurum metallicum. I gave aurum met 31 dose and he started improving. With that single dose, he became pain-free. There was a relapse after 2 months when he had sneezed and again pains had started. But there was no fear of pain and no shouting with the pain and all that. I repeated aurum met in 6C potency, which was given 3 times a day for 15 days. And then he was fine again. First time when he came for follow-up, he was walking with a stick. This is about 3 months after the first time I saw him. He came again after a month, he was walking by himself. And after another month, he came to my clinic all by himself, riding on a scooter by all alone. He was a groundsman at the local football ground. He started working again. So a case which appeared so hopeless that there was no chance got completely out of that disease process and became fit and fine. No, have any of you read Boger's Synoptic? It's a very interesting and important book, very small book. Boger was a real master, He practiced in the USA and people from all over America would come to him with very, very advanced pathology, and he was known to cure such pathologies. So he has written a book called Synoptic Key to the Materia Medica, in which he writes, the synopsis is intended to make clear the general expression or genius of each remedy, and thereby help the prescriber correct his bearings. So in that synoptic key, he has given the genius or important symptoms only, not all the symptoms of the remedies. And he says only this genius is important. what we do is, we have to do is, when you take a case, you repertorize and then you arrive at a group of remedies, right? Then for further repertorization, we have to match the genius of the patient with the genius of the remedy. Genius means the most outstanding feature of the patient or the remedy. So in the synoptic key, Boger has written only the genius of every remedy. And that includes, under every remedy, first is given sphere of action, then modalities, then pathological process, general characteristics, and then the mental characteristics. What we have to note here, that pathological process going on in the body is an important part of the genius. Here is a page from Boger synoptic key. Let me show you. This is Aurum Met. I don't know whether you can see it very clearly on your screen. But you see Aurum from Boger. Left side it is written first sphere of action: mind, nerves, vascular system, heart and all, bones, glands, liver, kidneys. Right side is given modalities: worse by what, better by what. And next it starts with vasomotor mobility, erratic ebullitions, venous congestions, means circulatory disturbance, which is a pathological process. Then it writes vascularity, wandering pains, they attack the heart, means sphere of action again. Pouring, cutting, osteoscopic, indurations, glandular and sclerosis, coronary, necrosis. These are all pathological processes. And later on, he has listed some general characteristic symptoms and mental symptoms. So you see how important the pathological process is. Burnett has explained the importance of pathology with the help of one of his cases. Let me show you what he writes. He writes, I once attended a young girl over a series of years for repeated attacks of congestion of the brain. She flushed up hot and red. Her pupils were wide open. She was restless. She tossed up about and talked nonsense. This is a fair picture of poisoning by belladonna, and hence belladonna was given each time, and each time it cured. Finally, in one of the attacks, the belladonna failed to act and the patient died. The end showed that the various attacks had been from tubercles. And then we clearly saw why it was that the patient died, and why it was that belladonna had cured the symptoms and yet left the disease proper behind, and whereof patient eventually died. And then Burnett writes, belladonna, as we know, is not capable of producing a morbid process analogous to tuberculosis. So because belladonna did not cover the pathology of tuberculosis, it did not cure the pathology of tuberculosis. This is what Burnett is writing. It only relieved temporarily. And then Burnett says, in the treatment of tuberculosis, notably of the brain coverings, I have sometimes succeeded with glonoine 3x and iodine 3x in alternation. I have used these two remedies in this form of consumption for many years with relatively satisfactory results, and have thus many a time brought unshapely hydrocephalic heads to something like shapeliness. So he has got success with other remedies which have the power to cure tuberculosis. You see how important it is to consider the pathology for prescription. In order to cure a given pathology by a certain remedy, that remedy must have the power of producing that pathology. That's the basic law of homeopathy. If you read Kant's cases, you will find that he would consider the pathology for prescription. I'll show you an example of repertorization taken from Kant's lesser writings. It is a case of a 3-year-old child. And Kent took the rubrics: aversion to being touched, timidity, enlarged glands, which is what? Pathology, swelling of the neck, subject to earache, this is also just pathology, enlarged abdomen, grinding of teeth. So many people say that, okay, Kent would say that you should not give importance to pathology and all that. This is what people talk and teach. But if you read his cases and if you carefully read the Kent's lectures on materia medica, you will see that he was considering pathology also for prescription. I will give you some more examples later. So for this case, Kent gave calcirec carb 10 and the patient got better. Let's see one more case from my practice. Now, this is a case of a 61-year-old lady. And she had this cerebral atrophy of the frontal lobe atrophy. The CT scan showed mild frontal lobe atrophy and hyperdensity in the soft tissue on the right side. And this is her story. She says 4 months back, numbness started in the toes. And slowly the whole left leg, left hand, and the left side of the face became numb. The skin of the soles of feet feels thick and numb. The left side of the tongue also feels numb. So we have symptoms going upwards and left-sidedness. Two important characteristics here. I get throbbing in my nerves and feel like rubbing the area. So rubbing ameliorates. Better by stretching. I am not able to hold anything in my left hand as the grip is not good. It feels loose as if there is no strength. I get cramps in my toes and calf muscles. My toes get twisted and become tight. I feel better by massaging. We already saw that rubbing ameliorates, so it's a general symptom. I can't bear any noise. I feel irritated and shout at them. I want them to stop immediately. If my daughter says anything to me, I brood over the same thing again and again. I don't get sleep the whole night. I feel nobody gives any value to me. I am tensed that when my daughter gets married and goes away, I will be alone. There is no one to take care of me. Who will take care of me? With tension, I get numbness of left hand and left leg. Then I am not able to do any work. My husband was an alcoholic, so I felt that I don't have anybody. I am alone, no support to look after my daughter. I was all the time in this tension. If something happens to me, who will look after my daughter? This feeling is still there. And I have this anger that instead of my husband supporting me, I had to support and work and support him. He doesn't give importance to my words, doesn't listen to me. He never supported me. I felt my own people have cheated me by marrying me to him. Whenever I am tensed, I experience weakness and I don't feel interested in work, as if there is no strength in my body. Now I don't mix with others. Doctors told me that I have first signs of paralysis. So I am tensed that if something happens to me, then who is there to take care of me? In my childhood, my mother would not treat me well. Even today, I feel that I did not get my mother's love. You see, with the mother also she feels that she is not loved. With husband also she feels the same. So whatever the situation, her feeling is the same. Such feelings are important. Nowadays, I wear sweater and socks to prevent numbness. So that was the case. Now, I'll show you the repertorization in the next slide. But let me tell you something about another way which we use to solve cases. This is a sensation method which is taught by Rajan Sankaran sir, who was my teacher. And in this method, we first decide that the patient is going to need a remedy from which kingdom? Mineral kingdom, plant kingdom, or animal kingdom? Those who need mineral kingdom remedies, they have a basic issue inside them. The basic issue is that there is something lacking. Like in this case, she feels she has not got love, care, value. Something she doesn't have. Not having what she wants. A feeling of lack, a feeling of loss. This indicates mineral kingdom. So she feels she has not received love. So issue is of lacking something, not getting something, which points to the mineral kingdom. And this, once you are in the mineral kingdom, then you decide which row of the periodic table the patient fits into. Love, care, and identity are issues of the third row of the periodic table. And she feels that those who are supposed to take care of her have cheated her or disappointed her. And she has been left alone. Being cheated, being disappointed, being left alone are feelings of the 17th column. See, this is the periodic table. See the third row, sodium, magnesium, aluminum, silica, phosphorus, sulfur, chlorine, argon. Chlorine is in the 17th column. It's a halogen. All halogens feel that they are ditched, let down, disappointed. And they feel all alone, and they feel that nobody wants them, nobody loves them. They feel restricted and they want to get out of that situation. So row 3 is about love, care, affection. Column 17 is about being ditched and cheated. And the element there is chlorine. So I knew that this patient needs a muriaticum. And then when I repertorized, these are the rubrics which I took for repertorization. Whenever you have strong modalities and generals, always depend on them more than any mental symptom. So that's what I did. I took direction of symptoms going upwards, rubbing ameliorates, stretching ameliorates, uncovering aggravates. She has to wear socks, no? Sensitive to noise, and the pathological process of numbness and cramps of muscles. And weakness of the muscles. Cramps, weakness of muscles, this is the pathological process. Weakness means paralysis of muscles. And the only mental symptom there is brooding, which is a constant inner case. When I repertorized, 2 muriaticums came up. Muriatic acid and ammonium. Now you see what is the genius. The genius of muriatic acid is debility. All acids, the genius is debility, great weakness. Other genius of muriatic acid is paralysis of muscles, no strength in muscles. That is why a muriatic acid patient slides down in bed, cannot sit up. Muscular numbness and cramping is also there in muriatic acid. Ammonium causes muscle spasms, cramping, but it does not cover the paresis. So this presence of the pathological process, considering this, I could differentiate and prescribe the remedy. So because along with other symptoms, pathological process was also covered. Muriatic acid 200, 1 dose was given to this patient. This was a constitutional prescription. Okay. She improved beautifully. After 3 months, when her follow-up was taken, she said that the numbness inside her cheek was 90% better. And the numbness in the rest of the body was 75% better. Grip also became normal. Her irritability and brooding became less. She started mixing with people. The tiredness and weakness after tension was 90% better. She said that before she would feel like sleeping at home all the time, but now she was actively doing all the work at home. Follow-up after another 8 months showed that the numbness and thickening of the soles has gone. There was no weakness. She said before she would feel giddy and as if she's falling to the left side, but after the remedy it never happened. No irritability, no anger. She's happy and mixes well with people. So whole system, physical as well as mental, had changed. So the first thing we learned today is that we should consider the pathology of prescription in pathological advanced cases. Remember, always give more importance to the peculiar symptom associated with that pathology. And then check whether the pathology is covered. Now let me clarify one more concept with the help of another case of mine. The next case is that of a 73-year-old man. And that's his diagnosis. This is in October 2013 he had come to me. I hope you read the diagnosis. He had ischemic heart disease with severe left ventricular dysfunction, with left ventricular failure, diabetes, peripheral vascular disease, gallstones, history of gangrene. So his left leg was amputated below the knee. Myocardial infarction twice and 2 coronary bypass surgeries. So the story was that he had developed coronary artery blocks again, already twice bypass surgery done, and again he has developed blocks in the coronary artery. And he was admitted because he had diarrhea and dehydration. They investigated, they found blocks again, they said, now we cannot do anything. He has already 2 myocardial infarctions, 2 bypass surgeries done. Again it has come up, but we can't do anything now. And he was in the hospital, admitted on drips, but showing no recovery in spite of hospitalization. So the hospital authorities told them, you please take him home. We cannot help anymore. He was too weak, too fragile. So they said, you just take him home. If anything happens, you just call the local doctor. And we can't do anything. We can't save him. So they had given up. They thought he will die in 1 or 2 days. So the hospital people here, some hospitals don't like if patients die in their hospital. They feel their name gets spoiled. So if nothing can be done, they send the patient home. So I said, okay, bring him on the way home from the hospital. Bring him in the car down. I'll come down and see. So I saw him on the day of discharge. I went down to the car. His cheeks were sunken. He was disoriented. He does not remember at all that I have spoken to him on that day. He just mumbled some answers to me. He was very weak and breathless. Did not have the strength to talk. So I saw him and then he was taken home and his wife told me some more history in the clinic, which I will tell you. In his papers, it was written he has hiatus hernia, esophageal ulcer at the gastroesophageal junction, duodenal erosion, diabetes now, operated for bleeding piles many years back, myocardial infarction in 2000, coronary bypass surgery that year, and same thing repeated in 2008. 1 year back, he was admitted in the hospital with dyspnea. And right leg was amputated for gangrene 7 years back. He was a chronic smoker and alcoholic. He had peripheral vascular disease. So after discharge, the same evening, he vomited mucus and water. He was exhausted after vomiting. He had abdominal pain and tenderness. And wife came and told us now he's tired. He can't even go to the toilet. He gets urged to pass stools but passes little stool, which is hard. 3 to 4 times in a day. Says his whole body is paining. When he's carried, he complains of body pain because he cannot bear the pressure of their hands on his body. He has craving for ice creams, cold drinks, and chocolates. Now, this is his constitutional symptom. Last 3 months, he didn't eat fish and rice, but otherwise, fish was his favorite. Now he is thirstless. He feels hot and now, since discharged from the hospital. Then the wife gave his whole history. Proper detailed case taking was done, and we got a lot of information about him. She says before he was operated, he would talk in his sleep. He would drink alcohol and he doesn't give bad words. He would feel that his wife has an affair, so he would fight and not talk to her. He loves dogs, doesn't like if you hit them. Now he doesn't talk much. His tongue is coated. He has pain in the abdomen with tenderness. That's in the gallbladder area. He has varicose veins with gangrene. Means he had gangrene. Pulse was feeble when I checked him. When I went down to the car to check him, it was a very feeble pulse. Family history: his father had cancer of the jaw. So that was the case. So what should be our approach? How do we handle this case? The diagnosis looks so scary, Hospitals have already given up. It's a simple case, you also know what is to be given. I like this slide which I received on WhatsApp one day. The art of knowing is knowing what to ignore. See, one fellow is drawing the beautiful scenery outside. He has ignored the bars, the grills of the window. The other fellow has ignored the scenery. He's seen only the grills. So the art of knowing is knowing what to ignore. Now, if this same case would have come to me about 15 years back, I would have considered every symptom from his case. That he's suspicious of his wife, he feels she has an affair, and he likes ice creams, and whatever. And found out one remedy for him and failed. Would have surely failed. But now I had to ignore that. I had to see only what is the current situation. So our approach has to be what is happening in his system at this moment. What needs to improve immediately? He is disoriented. He has giddiness and vertigo. There is no energy to talk or walk. This is because there is less oxygen reaching the brain and tissues due to stagnation of circulation. So this is the pathological process. When less oxygen reaches your brain, you become disoriented, you get giddy. And he has circulatory disorder. He has peripheral vascular disease. So circulation was very poor. That is why the pulse also was so feeble. This is what needs to be changed immediately. So this has to be covered. This is the genius of the patient. Cause is part of the genius. So cause was dehydration due to diarrhea, loss of vital fluids, grave disease, and lots of allopathic drugs which were going on. This was the cause. What was the pathological process? Stagnated circulation and poor oxygenation. And his current symptoms were very feeble pulse, debility, lifeless, breathless on least exertion, desire for fan and cold things. If you consider only this current state, by state I mean the cause, the pathological process, and the symptom. This constitutes one state. Then the prescription becomes simple. If you consider only this. So Carbo-Veg 6C was given to him. I put 4 drops in half cup water and was given 4 times a day for 4 days. And I got a follow-up after 4 days on 22nd October. He was much better, face color was better, eyes were looking better. He was alert, he was not dull anymore. Now we can understand what they tell him and he's talking to them now. No vertigo. Appetite is poor for solid food. He was taking only fluids and there was pain in the leg. And he had pain in abdomen. This was more now on this day. And he would whine when they would try to move him. That pain was in the right hypochondria. And a new just some disturbance in the background. Doctor always. There is some disturbance in the background. Can you stop the background noises? Hello? 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 There's a lot of noise in the background. Okay, thank you. So the new symptom was he had urge for stool and urine, but not able to pass. There was a dragging sensation there. He would just sit on the commode and wait. I gave him Merck core. This is called tenesmus. Okay. Now, right now, the tenesmus was bothering him a lot. So I gave him Merck core 6C. You see, there's a change in symptomatology. We change the remedy. 2 drops in half cup water, 4 teaspoons 3 times a day for 3 days. From that half cup. I called him again after 3 days. He said that tenesmus had gone. That infectious urge for urine stool was okay. But he gets tired after passing stool. He becomes breathless sometimes and feels weak. Pain in the right hypochondrium, he cannot lie on that side. Back pain and body ache. Again, he was feeling very hot and wanted the fan very fast. So, again, needs fan, feels hot, feels very weak. The same symptoms had come back. So, carbobage was given again. Three drops in half cup water, 3 times a day for 4 days. I saw him again after 4 days. He was much better. Weakness was better. Breathlessness was only after bathing. No problem with urine stool. Body pain was better. And they were so happy because now he had started shouting and scolding his children, which was his original nature. And that had come back. So they were happy. They said, now he is shouting at us. So we are happy. After a few days, he came back with more pain in the right hypochondrium. It was due to gallstones. And the swelling can be noticed externally when he sits up. That's what they said. He would bend forward with the pain and keep his hand on the painful area. He could not lie on the right side. He was moaning with the pain and had desire for cold drinks. His left leg was also paining. So we just repertorized it again, taking only the current symptoms. That is, lying on painful side aggravates, putting hand on the part ameliorates, and moaning with the pain. With desire for cold drinks, this came to phosphorus. We just checked and we found that phosphorus also covers gallstones and cholecystitis, the pathology. So phosphorus 30 was given twice a day for 2 days. I'm not showing the videos today. This has come up because I used it in other personal seminars. He was much better with that. The only thing left was burning in the amputated leg. No other symptoms. Every time he would come, I would go down to the car to see him because his one leg was cut off, so I didn't want him to come out. So now he was put on SL for a few days. After 5 days, again he came to meet me. His burning was better. He looked much better. Appetite was good. He says occasionally he feels weak and breathless, but the leg pain and backache was still there. As usual, I checked his pulse and I found pulse was feeble and it was so weak and so fast that I could hardly count it. Weak and fast. I couldn't count his pulse. Now, what should I do now? Do I just sit because the patient is improving, wait and watch, do nothing? Or do I act and do something to make him better? Like I said, 15 years back when I would follow only the constitutional remedy, one dose, wait and watch approach, I would just wait. Sometimes the patient would go worse after that. But now I've learnt my lessons. So I know that there are many states present. There is a lot more pathology to be cured in him. So I have to give him one treatment. Feeble and fast pulse is one of the indications of the remedy Crataegus, which is used for coronary artery blocks. Already he has had 2 operations. Now again he has coronary artery block. They can't operate. We can help. Crataegus cure really helps for coronary artery blockage. I have seen so many patients, their breathlessness stops and the cardiac symptoms just go away with Crataegus cure. So Crataegus pulse is feeble and very fast. And because he has coronary artery disease, right now I have Crataegus Q, 8 drops in half cup water, 3 times a day for 15 days. It was continued for some time after that. It was much better after that. When he came again, I could count the pulse. It was quite okay, normal. The gallstone pain was better. Crataegus was continued. A month and a half later, again I came down to see him in the car. Everything was okay except burning of the left ankle, foot and sole, which he said was better by hanging down legs. Legs mean leg, he had only one leg. And better by rubbing. And the sole was red in color. Again phosphorus came up. Again phosphorus was given. This time there was no change. It came back after a month or so. Burning the sole was same. Sleeplessness was same. Again I studied his case and I saw he has myocardial infarction twice. I asked what had happened at that time. And they said he suddenly started sweating and became unconscious. There was no pain. And then bypass surgery was done 15 years back. Now he was a chronic smoker and he stopped smoking only after his leg amputation 5 years back. Tobacco smoking causes clogging of the coronary arteries, leads to myocardial infarction. So it was tobacco poisoning state which had caused the myocardial infection. So I gave him tabacum 200 twice a day for 2 days. The same substance in potency. He was much better after that, except for an ulcer on the toe which was not healing. And pain in the foot and burning of the sole. That time I gave him carcinosin because of his family history of father having cancer of the jaw. He recovered very well after that. And many members of his family started coming to me for treatment. His handsome looks were back again, and his family would always say that he has gone from zero to hero. So I usually name this case as zero to hero. His whole khandan from Bombay and everywhere all started coming to me to Goa for treatment then. We see in this case that I have prescribed many remedies one after the other. And every time I have prescribed for the presenting state. Sometimes in pathologically advanced cases, we cannot see the constitutional state clearly. In such cases, we have to keep prescribing different remedies one after the other. Always prescribe for the presenting state or the state which is prominent at that moment. Change of indication will be indication for change of remedy. So the important point to be noted here is that many remedies were required to put the patient on the road to recovery. Hahnemann states in aphorism 171 of the 6th edition of Organon that in non-venereal diseases, those mostly commonly that arise from sora, we often require in order to effect a cure to give several antisoric remedies in succession. How many? You need several remedies. Every successive one being homeopathically chosen in consonance with the group of symptoms remaining after completion of action of the previous remedy, which may have been employed in a single dose or in several successive doses. So we need many remedies to cure. Let me tell you something which Burnett has written. Burnett, the real master in pathologically advanced cases. You must read his writings. It completely changed the way I prescribe. Made me much more successful in such cases. So Burnett writes, as we have already seen, it is not very often that we can cure a tumor with one medicine. And here I must explain. You take exception to the number of remedies used in my last case. I want to know which cured the case. Now this is in response to a question posed by his colleagues. Burnett and all, they would have these clinical meetings and they would present cases. And Burnett would always show them cases which were very pathologically advanced and how they have got cured under his treatment. They were people who would prescribe single remedy, single dose, and they thought that that is the only way to do it. But Burnett, Cooper, Clark, they were known as the Cooper Club. They all followed this, what they are talking, that you need pathology has to be covered, that you need many remedies to cure a case. Cooper, Burnett, and Clark. You know Clark's dictionary? Yes, same, John Henry Clark. So, once when Burnett presented one such case of tumor, many remedies were given, patient was cured. To make fun of Burnett, these other people asked him, Mr. Burnett, out of the many remedies that you have given, which one actually cured the case? So this is Burnett's answer to them. He says, will you get a long ladder and put it up against the side of your house and mount it so as to get into your house by the top window? And when you have safely performed the feat, write and tell me which rung of that ladder enabled you to do it. That was Burnett's style answer. He says, I sympathize with your objection because it was once my own great stumbling block in accepting the results of homeopathic treatment. Means Burnett faced the same thing. He was giving single remedy, single dose, but he was not getting good results. It may perhaps be adequately explained somewhere in the vast literature of the homeopathic fraternity, but I have never come across such an explanation, and hence have had to work out for myself. So Burnett says maybe somewhere in our literature it is written how to treat difficult cases like this, but I have never found it anywhere. So I have worked it out myself. This is what Burnett says. And says, I'll put it to you thus. In difficult, chronic, complicated cases of disease, you require not a remedy, but a ladder of remedies, a series of remedies, not one of which can itself effect the cure, but each of which works towards cure. Their cumulative action eventuating in a cure. That is how I cure cataract and many other chronic diseases that are currently held to be incurable by most men of all shades of therapeutic opinion. So he says you need many remedies one after the other. And he says, I regard this power of utilizing a long series of remedies for the cure of difficult cases as only second in importance to the law of cure itself. First is simila similibus curanda. Second is you need many remedies to cure. And it calls it the ladder of remedies plan. Means many remedies are required. What this means is that there are multiple states present in a patient and we need many remedies to treat these states. What are the different type of states and how do we treat them? The commonest mistake we make is that we, even in such cases, we look out for that one constitutional remedy which we think will work miracles for us. But somewhere the cure gets blocked because actually there are multiple states present and we need to address every state and remove it with the help of appropriate remedies. So the second important principle we learned today is we need multiple remedies in pathologically advanced cases. Once I became aware of these blocks, I began to look for ways to overcome these blocks. And once again, the masters came to my rescue. The works of masters like Hahnemann, Burnett, Kent, Clark, Boger helped me to devise a technique of overcoming these blocks. And the concept was first put to use by Hahnemann. He observed that patients stopped improving in spite of taking well-selected remedies. In order to find a solution, he started to study the past and family history of his patients. This led to the discovery of three miasms, Sora, syphilis, psychosis. In majority cases, he found that there was history of suppression of scabies in the patient or his ancestors. And this had led to an array of diseases. He named this pathological process as the miasm Sora. In some patients, there was a history of suppression of gonorrhea in the patient or his ancestors. He named this disease process as miasm psychosis. And in some patients, there was a history of suppression of syphilis in the patient or his ancestors. He named the miasm as syphilis. These miasms are genetically transmitted from one generation to another and need to be treated if we have to cure a patient. Just giving constitutional remedy is not enough. That's what Hahnemann realized. Sora was also transmitted by touch. So this Hahnemann's concept of disease is an etiological concept of disease. That is, it is based on the cause, scabies, gonorrheal infection, syphilis infection, and the pathologic process following these infections. Well-selected remedies fail to act when such a miasmatic block is present. That is, when you have not given the anti-miasmatic remedy. Your cure gets blocked. He writes in the chronic diseases that these miasmatic blocks can be removed with the help of specific anti-miasmatic remedies. In this book, in the chapter of cure, he writes that we now proceed to the homeopathic treatment of illimitably large number of chronic diseases, which after the above gained knowledge of the threefold nature has not indeed become easy, but what without this knowledge was before impossible has at last become possible. So without miasmatic treatment, he said it is impossible to cure. But now it has become possible because the homeopathically specific remedies for each one of these three different miasms have in great part been discovered. The important word here is specific remedies. Hahnemann found homeopathically specific remedies for every miasm. No individualization there. Please read The Chronic Diseases by Samuel Hahnemann. I was shocked when I read it. Because what was written was something which I had never understood before. We were not taught like that. We were taught that only individualization is important. But Hahnemann writes that when you are prescribing anti-miasmatic, to remove this block, then you need to give specific remedies. Then he writes how to treat psychosis. And in that he writes that the gonorrhea dependent on the figwort miasma, as well as the above mentioned excrescences, that is the whole psychosis, are cured most surely and most thoroughly through the internal use of thuja. And when these have exhausted their action after 15, 20, 30, 45 days, alternating with just a small dose of nitric acid, which should be allowed to act for a long time to remove the gonorrhea and the whole psychosis. He says first give thuja, then give nitric acid. To treat Hahnemann's cases where he has done this and cured. So according to him, these are very specific antipsychosis remedies. For syphilis, he says, you give the best prescription preparation of the semi-oxide of mercury. It is the most excellent antisyphilitic medicine. For him, antisyphilitic means it was mercury. And about Sora, he writes that Sora, he says, it has developed into one of the innumerable chronic diseases springing from it. And it is very seldom cured by any single antisoric remedy, but requires the use of several of these remedies. In the worst cases, the use of quite a number of them, one after the other, for a perfect cure. So he says psychosis and syphilis is easy to treat, but Sora, which is the most destructive miasm according to Hahnemann, needs several remedies to treat, several antisoric remedies. And then he gives us one hint. He says in very tedious and complex cases, means pathologically advanced cases, which are mostly such as have been mismanaged by allopathy, it is nearly always necessary to give again from time to time a dose of sulfur or hepar according to the symptoms. So in complex cases spoiled with allopathy, he says very frequently you have to give sulfur or hepar. You see, sulfur comes in every repertorization in every patient's case. That's because every patient needs sulfur sooner or after, sooner or later. So whenever peculiarities of sulfur pop up, give sulfur. This is how Hahnemann would practice. Now, we have used some more specific anti-miasmatics. For Sora, we use sulfur, hepar sulfur, soranum. Burnett would use soranum more than sulfur. Hahnemann never used nosodes as anti-miasmatics. For psychosis, we use thuja, nitric acid, natrum salt, medorinum. For syphilis, mercury salts and syphilinum. For tuberculosis miasm, we have tuberculinum and bacillinum. For cancer miasm, we have carcinosin as a specific anti-miasmatic remedy. This tubercular and cancer miasm were added by later masters. As I said, Hahnemann never used nosodes to treat as anti-miasmatic. But Burnett, Kent, Boger, Clark, all of them used nosodes to treat these miasms. I started using this concept in practice and it helped me to solve many cases. There are some more blockbusters which we need in complicated cases. You have to identify where the block is. The block may be because you have not selected the right constitutional remedy, or you need some pathology specific remedy, or some acute remedy, or you need anti-miasmatic remedy to clear the block, or you need a nosodes or sarcodes or remedies for any other acquired states. So these are the different blocks. And we need to use different type of remedies to remove these blocks. Nosodes are of great use whenever the patient has not been well since a certain infection, not well since pneumonia, not well since chickenpox, not well since measles, not well since herpes. We need a nosode of that disease for that. Or whenever the infection has pushed the individual state of the patient into the background and strongly established its own state. There is an example from Clark dictionary. That's Clark. In morbillinum, morbillinum is the nosode of measles. He writes, for an attack of measles, I find nothing better than morbillinum 30. So what is he giving? The same substance in potency. Under coffea, Clark writes that coffee prevents or neutralizes in many persons the effects of roasted coffee. This quasi-isopathic action is by no means confined to coffee. Quasi-isopathic means similar to isopathic. Dynamizations of many other drugs being antidotal to secondary effect of this crude substance. So what it means is the pathological process produced by a toxic substance can be removed by administering the same substance in higher potency. Kent writes that when there is family history of tuberculosis, we should give tuberculinum to the children in high potency to prevent tuberculosis. It's the same substance in potency. He writes that if there is a patient who has family history of gonorrhea and does not improve with your regular remedies, give medorinum, it will solve the case. Medorinum is produced from the gonorrhea discharge. Same substance in potency. As qualified homeopaths, one of our jobs is to prevent diseases, right? Borik and Phatak write that nosodes should be used to break the block whenever the well-selected remedy fails to act. Apart from nosodes, sarcodes also play a major role as blockbusters. Whenever there is a pathological hormonal disturbance in the system. We see a lot of thyroid disease and polycystic ovarian disease now. And such cases can be cured easily with the help of sarcodes like thyroidinum, TSH, uforinum, folliculinum, etc. Of course, you also need to prescribe the correct constitutional remedy and specific anti-miasmatic remedies and the necessary nosodes. Besides these states, there are some acquired states which pose blocks and need to be removed. Like some infections. Patient in between has an attack of pneumonia and then comes to and says, I'm not well since pneumonia. Give pneumococcin. Acquired infections. Patient who has taken a lot of antibiotics, steroids, hormone therapy, chemotherapy will need certain specific remedies to remove their effects. Addictions like tobacco, narcotics, alcohol. Somebody who is been smoking tobacco a lot has tobacco poisoning. You need to give tabacum to counter that state and remove the block. Electromagnetic radiation of computers and mobile phones. Vaccinations. These are all acquired states and we have to remove these blocks. There are many other nosodes and sarcodes and other blockbusters which are needed in practice. And you will be able to help many of your cases if you understand how to use them and the philosophy behind their use. We live in a world which is full of adverse conditions, which create disease states in us. And many times a single remedy is not sufficient to get rid of these states. The blockbuster technique will help you to overcome the blocks posed by these evils. So in today's session, we have got a glimpse of the blockbuster technique. Let's summarize what we learned today. Pathology is important. Multiple remedies are needed in complicated cases. All blocks in the process of cure need to be removed with appropriate remedies prescribed for the presenting state. You will need constitutional remedy, acute remedies, pathology remedies, anti-miasmatic remedies, nosodes, sarcodes, and remedies for other acquired states. These different type of remedies serve as excellent blockbusters and help us to deal with pathologically advanced cases. Whatever I spoke today were general guidelines for treatment of all types of pathologically advanced cases. But different diseases require refined specialized techniques. The blockbuster method has individual strategies to treat rheumatism, neurological cases, thyroid problems, diabetes. There is a lot more to learn about this concept of blockbusters in homeopathy. And I hope to share the finer nuances of this method with you in the near future. Thank you and best wishes. Yeah, Dr. Alvin, I am done.
What is happening?
What is happening?
Thank you, Dr. Ashok.
Thank you, Dr. Ashok.
Good evening, one and all. It takes me immense pleasure as a viewers chairperson for the free and paraclinical subject to prepare for board.
Many hands and brains put together made it a successful webinar. I put forth my gratitude on behalf of the Institute, Enipoya Homeopathic Medical College in Boston, to thank the speaker of today's session, Dr. Ashok Borkar, one of the leading practitioners in Goa, for upgrading our knowledge with management of pathological advanced cases.
Thank you, sir. Our today's participants, I thank you all for respecting our reputation and making the forum more acknowledged. Thank you. Last but not the least, a special thanks to the management Enipoya University for supporting us to come out with this series of webinars. A big thanks to them. It's not easy in the midst of heavy schedule to contribute to the society, but our Dean, Dr. Vivekanand Vernikar, sir, paved the way to help all the benefits from this forum. Thank you, sir. As mentioned earlier, many hands and brains to make it a success. I thank the head of the Department of Science, Dr. Shilpi Rastogi, of the Department of Anatomy, coordinator of the webinars,
Dr. Fishput, Dr. Rupa, Dr. Lawson, Dr. Apeksha, Dr. Melita, Dr. Jeetu Joseph, and the IT Department of Ayush, the tremendous effort for the same. Thank you, one and all. Myself, Dr. Head of Department of Organ of Medicine with Homeopathic Philosophy, will now take leave of you all. Have a pleasant evening. Thank you. I couldn't go with this. Oh my. I couldn't go with a sweet voice because the voice was echoing and I was not aware what is happening.
10 things beyond my expectation. Keep it.
For what? है ना यहाँ पे खोपड़ी में. Sir, can you just help me telling Nidhi sir that we are done and we are coming
Yeah,
so that he
yeah.
doesn't rush giving us a false alarm.
Okay, don't. So slowly, don't miss anything.
Just give me a call. Class will take a lot of time.
Thank you all the guests for attending the meeting.
Yeah, Apeksha.